My name is Lisa Oglesby, and I'm the director with the Brandywine Women's Health Associates Marketplace Guides. Brandywine Women's Health is located in Wilmington, Delaware. We're an OBGYN practice that Dr. Cecil Gordon is an OBGYN that's been in practice for 30 years. The beauty of the practice is that not only does it offer OBGYN services, there's also psychological services, nutritional services, adolescent pregnancy prevention services. I mean, just looking at the whole person. And with the Affordable Care Act, that's just a natural extension of the practice. The caring and compassion that the practice has had is mirrored in being associated with the Affordable Care Act and the Marketplace Guides.
I have really witnessed many examples of why affordable health care is such a blessing right now in this day and age. In my 30 years experience, there's been times where I worked right on the front line in the hospitals and watched patients come in the door with no insurance, underinsured, who has multiple problems related to the fact that they did not have any kind of health benefits. Multiple problems, and this is obstetrical care. Babies, people who are addicted, people who have multiple health problems that just never sought care because they just didn't have any kind of insurance, and they use the emergency room in their triage settings as their way of getting care. That is not the way to go.
I believe that the Affordable Care Act is a big step for this country to take. I applaud the efforts of President Obama for getting it done. We should strive to make health care available to every citizen in this country, and this is a first step. It'll go a long way in reducing the health disparities that we see now in certain populations and certain ethnic groups. I really feel strongly that we will make a tremendous difference at Brandywine Women's Health Associates, reaching out to that community and being able to bring them into the fold, to provide a service that we know that they all need.
It's just exciting. I mean, we have an awesome group of people, very compassionate, a lot of energy, ready to get out for the general marketing phase, and then come October 1, we'll be able to go out and do the actual enrollment period. That's when it starts. So really, a lot of energy here. We have our press release kickoff for the Brandywine Women's Health Associates on September 9th. So we're ramping up for that, and we're just ready to go. I mean, we've done everything. We're doing the training so people know where they're going, what they're going to say when they get there, because we've been prepared, we've been trained, and we're ready. And we're ready to help people, because ultimately, that's what this is all about with the Affordable Care Act and the association with Brandywine Women's Health Associates, a caring practice that's been around for a long time doing this.
You know, healthcare is about prevention, and this initiative is about prevention, not providing a service necessarily for a person who is in the latter stages of a disease or a chronic illness. And I'm looking forward to being able to address the preventive aspects that Affordable Care Act will allow us to do.